Hello, I am Janelle and I'm going to be performing my abdominal assessment today. First, I am going to scan the room to show that there's no notepads, sheets, or anything like that. First, I am going to check my patient's charts and the doctor's orders. Then I'm going to provide for patient privacy, which would be closing a curtain, or in this case, I have closed the door. Then I'm going to perform hand hygiene, and then I'm going to make sure I have the correct patient with 2 identifiers. Can I see your wrist, please? What's your full name?
Stephen John Clemick.
And your date of birth?
12/13/1995.
And do you know where you're at today?
Silverwood.
Okay, my patient's LOC is +3, showing me he is alert and oriented. First, as I start this assessment, I'm going to be looking at his skin, which seems to have a pink undertone. His hair is thick, it is full and evenly distributed throughout his head, his eyelashes, and his eyebrows. His skin is warm and dry, which is a good finding. Okay, and what brought you in today?
Checkup.
And are you in any pain?
No.
Have you noticed any changes in your appetite?
No.
No? Okay. And would you say you have a well-balanced diet?
Not really.
Okay, can you describe your diet for me?
A lot of fast food and soda pop.
Okay, would you say you have a little bit of food from each food group every day?
No.
Okay, well, it is important to have some from each group, such as fruits, vegetables, grains, dairy, meats, to make sure that you get all the nutrition that you need. And have you experienced any nausea or indigestion? No? And when was your last bowel movement?
This morning.
Would you say it was regular for you?
Yeah.
Have you noticed any blood or mucus in your urine or stool?
No.
Okay. If you were to notice urine or blood in your urine or stool, especially in the stool, it could indicate a ruptured hemorrhoid, an ulcer, or some type of tear in the intestine or the digestive tract, which would need to be seen by a doctor. Okay. And can you lay down for me?
Yep.
Okay, I'm going to up his shirt. Okay, I am going to inspect my patient's abdomen. I do not see any masses or lesions or rashes available. I do see 2 bruises. Do you know what happened there?
I bumped him at work.
Okay, and have you experienced any pain or problems with it?
No.
Okay, so bruises, they happen, so I'm not concerned about that. I'm going to note that his umbilicus is midline to the rest of his body, his abdomen. I don't see any distended veins or pulses. His stomach appears to be flat. It's not bulging or sunk in, indicating malnutrition or obesity, which is a good finding. He does have a little bit of hair, which seems to be evenly distributed and very normal. Okay. First, I'm going to start by auscultating for bowel sounds in my patient's abdomen before I percuss or palpate. And I'm going to be using the diaphragm. I'm going to start in the right lower quadrant. Into the right upper quadrant. And then the left upper quadrant. And the left lower quadrant. I was listening for gurgling sounds, which I did hear. I would say that he is normally active, which bowel sounds should be between 5 to 30 sounds per minute. I did hear some gurgling, and I would say he's within that range. If it was hypoactive, it would be less than 5 sounds per minute, and if it was hyperactive, it would be more than 30 sounds per minute. Next, I'm going to auscultate for bruits in my patient's abdomen through the abdominal aorta, going to the renal area, iliac area, and then femoral area. And this time I'm going to be using the belt of my stethoscope. I'm going to start at the aorta, the abdominal aorta. And then I'm going to go to the left renal area. And then the right renal area. And the right iliac area. And the left iliac area. In the left femoral area. In the right femoral area. Okay. I did not hear any whooshing sounds, which is a good finding, noting that there is no bruit. Next, I'm going to percuss my patient's abdomen, and it should sound tympanic since there is air throughout the intestines. I'm going to start in the right lower quadrant, or right upper quadrant. Okay. It did sound tympanic. In the left upper quadrant, it did sound a little dull, which is a normal finding. Okay, next, I'm going to lightly palpate my patient's abdomen, starting in the right lower quadrant. And the light palpation is going to be about 1 centimeter down, and you're just going to use your first 4 fingers to feel for any masses. Go to the right upper quadrant, and then the left upper quadrant, and then the left lower quadrant. Okay. I did not feel any masses, which is a good finding. Okay. You can sit up for me. Okay. Throughout this assessment, my patient's face and body language has remained appropriate for the situation. I have assessed his skin throughout the entire thing. It has remained a pink undertone. There has not been any signs of masses, lesions, or rashes throughout his entire body. His skin has been evenly distributed, and there have not been any abnormal findings.